Well, this patient has been referred to rule out any fetal anomaly. So this is the femur. Magnified view of the femur, and to me it shows relatively poor calcification, and not only that, see, its thickness is also seems to be compromised, 1.6 mm thick, and it measures approximately 6.0 and the 6.0 centimeters, and the gestational age as per this measurement is 31 weeks plus minus 2 days. Okay, now this is the femur. Ahead, so the femur, and now you see there is bowing of the and the biparietal diameter. Femur length is showing 31 weeks, biparietal diameter shows 36 weeks. Now let's see the other diameter, other measurements as well. The occipitofrontal diameter, keeping this one in, the occipitofrontal diameter, keeping the same image in view, corresponds to the gestational age of 34 weeks. No, I have to do it again. From here to here. It's giving discrepancy. Maybe I'm not measuring properly. 34 weeks. I will go for the 34 weeks, and occipitofrontal diameter being done. Let's take the head circumference, and the head circumference corresponds to the gestational age of, see, 36 weeks. So these two measurements, biparietal diameter, head circumference, they are equal to each other, whereas femur length is 31 weeks. Now let's see the, let's go to the abdomen, and let's see that what is the abdominal circumference, gestational age by abdominal circumference. This is the stomach, the vertebra, and this is the umbilical cord, like a vein in front of us. This is the umbilical cord, the stomach bubble, the vertebra, and the transfer of the abdomen, the anterior abdominal wall of the fetus, and the abdominal circumference corresponds to the gestational age of 34 weeks. I think it's not the correct measurement. Let's do it again. Let's do it again. Okay. Abdominal circumference. And now this is 36 weeks. So all these measurements, biparietal diameter, head circumference, abdominal circumference, they all correspond to the gestational age of 36 weeks. However, the only length that is not correlating with the other parameter is the femur length. It's showing 31 weeks, whereas rest are showing 36 weeks. So there is discrepancy between the these measurements. Now this is the chest. You can see the heart, 4-chamber view of the heart, with the cardiac activity ranging between 136 to 140 beats per minute with regular waveform. Okay, so stomach bubble is seen. This is the urinary bladder of the fetus. This is the urinary bladder. It's full. This is the kidney of the fetus. Yeah, this one. 4.3 into 1.9 centimeters kidney. These are the facial features. This is the mouth of the fetus. The amniotic fluid is adequate. There is no evidence of any poly or oligohydramnios. And the fetus is a male fetus. This is the scrotum, and you can see the penis as well. This is the scrotum, this is the penis in this case. So this is an XY fetus, this is the penis. Male fetus. Now let's have again a look towards the bones. This is the femur. Calcification is less, the length is less as compared to the normal, and because scanning in the 36 weeks for fetal anomaly is not easy. Because of the muscle mass and all the other factors combined together. It's at times difficult to get the bones. Now you see, this is the tibia, and you can see the bowing of the tibia. This is the tibia. The initial one I showed you, I am very sorry, this is the femur, this is the femur. No, this is the tibia. So, and the initial one I showed you, that was not, in fact, that was the femur that I labeled as the tibia, whereas this is the tibia showing bowing, less calcification, and measuring 2.7 centimeters. Now this diameter, this length is also less as compared to the normal. The placenta is posterior wall, and grade 3. However, it does not reach the os. Head is all engaged, so difficult to get that, but it appears to be above the os. So this is the stomach bubble, the urinary bladder, the heart, and let's see the facial features for a while. You can see this is the eye, This is the nose, this is the mouth, this is the tongue, this small fit-like structure. This is the mandible, and so these are the facial features showing no significant. Now these are the two nares. You see this small slit-like structure, this slit-like tiny structure. These are the nares. होगे तो फिर नींद आएगी बच्चा. This is the umbilical cord. Umbilical cord is normal, 2 arteries, 1 vein, and just a shot of jelly. Now this is the end of the fetus. Clenched fist. However, we can count the number of digits. The digits are normal in number. All the bones, even the upper arm bones, are showing less calcium. Now this is the fetal hand. You can count the digits. See what the guy is doing. These are the tibia and fibula. The radius and ulna, the hand, and now here you can see that these are the upper arm bones. So this is our case of the day that shows these discrepancies with all other fetal parameters seen normal. The discrepancy is between the femur length as well as the other bones, fetal bones. However, the hand, if we see the calcification of the hand bones, these are showing normalcy. So anyway, this is our case of the day. Thank you very much. Now in all such cases, one must see the neck, the vertebral column, the thoracic cage, and this is the neck of the fetus that appears normal. This is the vertebral column. I am going to follow the vertebral column This is the cephalic end, and this is the caudal end. And there is no discrepancy seen. Now another thing that should be seen in such cases is the respiratory movements of the fetus. Let's see the respiratory movements. Just a minute. Now I'm going to keep the probe at one place. It is at one place, and you can see the contracting and relaxing abdomen. See the contraction, the relaxation. This is the breathing. Now the stomach bubble measures approximately 4.5 by 1.6 or 1.7 centimeters. Now this is this a case of pyloric stenosis as well? Because the stomach bubble is seen distended. I will say no, because number one, it requires at least 3 consecutive ultrasounds to be sure that the stomach bubble is dilated and the diagnosis of pyloric stenosis could be made. Secondly, in such cases you will see oligohydramnios, which is not the case in this patient. So, and you can see now see the movement of the fetus. एक मिनट बेटा, तेरे में इधर आ गई. See the respiratory movements. So now, having seen this, you can see that are the fingers normally placed? I really doubt that there is a gap. What I am seeing is that there is gap between the fingers, and digit number 1, 2, 3, 4, and 5. Now, regarding the facial features, you should be able to see the fetal neck bridge. If it is depressed or not. It takes actually the ideal time to scan for these anomalies is between 14 to 16 weeks of gestational age. At this stage, it really becomes very difficult to analyze with the conventional ultrasound machine that I am using. These are the moves of the hand, upper arm and the lower arm. Now coming back towards the facial features, no significant anomaly is seen. So we have seen the vertebral column. Now what about the thoracic cage? This is the heart. So the thoracic cage is normal. Don't see any shortening of the thoracic cage. So this is how we evaluate in such patients. So I'm satisfied so far as the thoracic case is concerned.
Thank you very much.